talk or I give my talk. And Mary, if you can monitor that, it'll be easier on me. All right, let's get started. I'll share my screen. Uh, so let me know if everybody can see the slides. Not yet.
Not yet.
How about now?
Yes.
Yes.
Yay. All right. Play from the start. So, as Mary mentioned, uh, we'll be talking about dementia prevention, but in the future, we are hoping to also talk about stroke prevention, Parkinson's disease prevention. And I'll be focusing today on 17 established modifiable risk factors for future dementia. I'm part of Saint Alphonsus Memory Center in Boise, Idaho, and we also have clinics in uh, Eagle and Nampa. Uh, no financial disclosures. The learning objectives, as I mentioned, is to describe these 17 potentially modifiable risk factors for dementia that research to date has established, and then share some practical tips for all of us to reduce our own risk of future dementia. So recently I had a patient, uh, 88 years old with Alzheimer's dementia in moderate stages. He was brought by his grandson, who's 44, and the grandson mentioned that he has also noticed his father becoming somewhat forgetful, but he thinks that's just normal part of aging. And so I had mentioned that uh, we are doing this session on dementia prevention, and I can provide some guidance to him also. And he was pretty confident that he's not going to get future dementia. So to me, many of us underestimate our risk of future brain health problem. That's optimism bias. It's a double-edged sword. It's a good thing temporarily, but I'm not sure it's the best long term. And then, but he did say that he has some concerns about his future brain health, but it's very vague. Uh, and that's again not uncommon for many middle-aged individuals to worry about their future brain health. But then he mentioned that he does crossword puzzles and he keeps his brain active. So he felt that that was his way of preventing dementia. So to me, that's a very simplistic understanding of what factors drive brain illnesses and dementia specifically. Uh, I asked him if he has talked about, his concerns to his primary care physician during annual wellness visit, and he said no. Again, not uncommon. I think in the future, primary care providers, primary care uh, physicians will be proactively talking about brain health and stroke prevention and dementia prevention and lifestyle interventions. Uh, Again, when you have family history, even more people are worried about developing future dementia in the future, but only 10% of them, talk to primary care providers about dementia prevention. And one of the things that I explained to him was that the Alzheimer's disease starts long before you develop memory problems. Now, although Dr. David Volk talks about 10 to 15 years, one could talk about 20, 25, even 30 years that the disease process has been going on before you develop significant memory decline or obvious decline in what we call neurocognitive functioning, uh, thinking, memory, language, planning, etc. So again, if the disease process starts that early, then prevention needs to be starting that early. So if the onset of dementia in his grandfather was in his father, let's say, who's starting to develop mild cognitive impairment, the earliest stage of Alzheimer's dementia, that the stage before Alzheimer's dementia, then the disease process has been going on in his father for at least 10, 15 years, maybe 20 years. Uh, Again, Dr. Thomas Pearls has done a superb uh, work on centenarians, people who live 100 plus. And in this paper, he clearly indicated that there are people who have Alzheimer's neuropathology in the brain, but they never develop any clinical symptoms. He uses the word that they are resilient to Alzheimer's disease. And then there are centenarians who don't have any evidence of Alzheimer's disease neuropathology in their brain. He calls them resistant to Alzheimer's disease. So somehow these individuals have resisted developing Alzheimer's disease. But it's important to recognize that just because one has the disease in the brain doesn't mean that you will 100% develop memory decline and future dementia. Uh, Me and my colleagues had written about evidence-based methods to preserve brain function and prevent dementia 14 years ago. And then you fast forward now, and now we have 14 established risk factors that together account for 45% of dementias worldwide. Now, this is from the 2024 report of the Lancet Commission. So when we published our 2010 articles on dementia prevention, these factors were not established. Then there were 12 factors established earlier in 2020, and then 2024, 14 factors were identified. Now, this is really a paradigm shift once we understand this information. So in the past, a lot of us and people thought dementia is just genetic and nothing can be done about it. So we need to really take this very, very seriously, that there are many modifiable risk factors that if we proactively address, we can reduce our future risk. Currently, around 10 million, more than 10 million individuals across the world, our planet, every year develop dementia. So if, let's say, these 14 factors were eliminated starting, say, 1st of January 2025, then 4.5 million people will not develop dementia in 2025. So that is phenomenal. So what are these 14 risk factors? So early life is no secondary education. So again, whatever we can do to promote education in childhood can greatly improve their future brain health, and that includes delaying the onset of dementia or dementia prevention. As you see, the bulk of the risk factors in midlife, so hearing loss, high, low density lipoprotein, depression, traumatic brain injury, smoking, diabetes, physical inactivity, hypertension, obesity, and excessive alcohol consumption. So we are talking about 9 potentially modifiable risk factors in midlife. And then late life, we have 3: social isolation, air pollution, and vision loss. Sorry, there are 10 in midlife and then 3 in late life. So again, this translates into it's never too early to start making brain health a priority, and it's never too late. Again, a reminder that our brain is neuroplastic. It has a capacity to change for the better, if we do all the things that support our brain function and brain health, and the brain can change into negative function if we have lifestyle that is harmful to the brain. All the percentages you see in each risk factor tells you that if you eliminate this factor, that amount of future dementias will not happen. For example, if suddenly we fix everybody's hearing loss by 2024, and we all started off on 1st of January of this year with nobody having hearing loss across our planet, then 7% of people who otherwise would have developed dementia will not develop dementia. So 7% out of 10 million is 700,000. So that's a high number. Again, if everybody stopped drinking completely this year, then 1% less would develop dementia. Now, obviously, a lot of these factors work over years. So I'm simplifying, but that just tells you the impact of addressing all these factors. And also look at the numbers, like social isolation is, in this sense, more neurotoxic than excessive alcohol consumption. So, and from COVID pandemic, we quickly realized that that is true. We have felt it. And a lot of these risk factors can influence each other. Like if you have hearing loss, there's a good chance you might develop dementia, you might reduce your social interactions. So then all these factors add up to your future reduction in brain health and increase your risk of dementia. And more recently, the American Heart Association clearly indicated that atrial fibrillation, heart failure, and coronary heart disease are also risk factors for future dementia that we should recognize, and we should offer these patients comprehensive brain fitness programs, and we'll talk about that. We have one at our memory center. We call it Brain Health Program. We need to realize that these modifiable risk factors, so the 14 and then the 3, so there are a total of 17 established, interact with unmodifiable risk factors. So age. So again, we are all at risk for dementia just because we are going to age. But also if we have a family history, certain genes like ApoE4, specifically in white population, that's where all the research has been done. And then Down syndrome, trisomy 21, where you have 3 chromosomes of a specific, that code for a specific protein. They have the gene on that chromosome that code for a specific protein that accumulates and then eventually causes dementia. Now, although I've mentioned these 17 risk factors, one of the documents we'll email you is Dementia Prevention. It's a rough and tumble ebook written by my wife, who's a psychologist, and I. And we have also mentioned some other risk factors that in the future might become established. Currently, they don't have as much research. For example, chronic insomnia, hypersomnia, obstructive sleep apnea, poor oral health, periodontitis, gum disease. In Japan, they have many countries have like a dementia program for their whole country, and Japan has it, and they have specifically mentioned poor oral health as a factor for dementia prevention. And then there are certain medications which have anticholinergic effects, so they block a neurotransmitter in the brain, acetylcholine, and if one takes it for a long time, then it could increase your risk of future dementia. So again, more to come. As I mentioned, there are certain genes. The most research has been in this gene, ApoE4. So if you have 2 copies, your chance of future dementia increases 8 to 12 fold. And this is in comparison to if you have, say, ApoE E3. Now, again, most of this risk is in white population. Currently, most experts, including myself, don't recommend doing ApoE4, like in that grandson that I spoke about. He asked me, should my grandfather do ApoE4 and should my father do it and should I do it? And I counseled against it, and we can talk more about the pros and cons. But in most cases, sometimes it adds more stress and anxiety and not as much benefits. I told him that, if when you lose your drive to stick to a brain healthy lifestyle, then you imagine that you have both the copies and that might increase your motivation to stick to the plan. And when you get too anxious, then you can tell yourself that you may not have ApoE4 and actually you might have ApoE2 and you have less risk for Alzheimer's. Many of us wonder how all these factors influence brain health. And obviously, education is clear. Education will improve the number of brain cells, brain connections. There is intense new learning in school and childhood. And that increases your brain bank balance, number of cells, number of connections, the capacity for the brain to compensate when you have dysfunction in certain networks. So all that goes into the word or concept of cognitive reserve, brain reserve. And then these risk factors like hypertension, diabetes, high, low density lipoprotein can trigger vascular disease in the brain. So narrowing of the arteries, reducing the blood supply to the brain. They can promote development of toxic proteins like amyloid, tau, alpha-synuclein. These are different proteins linked to different dementias. Tau and amyloid together are linked to Alzheimer's disease. Alpha-synuclein is linked to Parkinson's disease and Lewy body dementia. And then also there are other mechanisms described like glutamate excitotoxicity. These are important because in the future we might have medications that directly influence these mechanisms, and then that's another way to prevent dementia. Other proposed mechanisms are chronic inflammation, so we can talk about anti-inflammatory lifestyle, anti-inflammatory diet, chronic oxidative stress. So we all, are developing oxygen-free radicals that are harmful to our body just by our normal living and metabolism, and the body has a way of clearing it up. But many of these risk factors might increase this kind of stress, and then the body can't catch up. And then if you do all these healthy lifestyles like exercise, brain healthy nutrition, increasing in your social interactions, then it might promote neurotrophic factors, certain chemicals that might improve brain connections and the life of the brain cell. So again, we all need to talk to our primary care providers about dementia prevention education, talk to each other. This is freely available in English as well as in Spanish on our website, Saint Alphonsus Memory Center. Please download the book. We can email it to you too, and it has many specific actions you can take and guide. And obviously you can take appointment with us and we can give you more personalized guidance. Again, it's not easy to stick to healthy lifestyles, so share your struggles with your primary care providers, ask them to share their struggles with you. I'll be happy to share my struggles. Then we'll send you another resource, a tool, a McCann's Brain Care Score, and you can do your own scoring. For example, if your blood pressure is less than 120 by 80, you get a score of 3, which is good. The blood pressure is normal. If you get a blood sugar, hemoglobin A1C less than 5.7, you get a score of 2. And same way you can score yourself on cholesterol, body mass index, nutrition, alcohol, smoking, aerobic activities, sleep, stress, social relationships, and meaning in life. And your goal is to improve your score, and that would reduce your future risk of dementia. Again, seek our help. We have several experts right here. Currently, right now, I know two, Dr. Coons and Dr. Melchiori. Uh, we can all try and help each other. These are some of the references. This is a great short YouTube video I recommend by Dr. Manson, who describes these 14 modifiable risk factors, freely available, and then some recommended podcasts and books. So we'll send you the slides also. Let me stop here and we can open up for discussion, but my recorded talk is over. Hope this has been helpful.